All right, that could go on for a while. Experience the long-lasting freshness of Clorox Scentiva, available in Clorox Scentiva Lavender-Scented Bleach. Use as directed.
The number one selling product of its kind with over 20 years of research and innovation. Botox Cosmetic, out of botulinum toxin A, is a prescription medicine used to temporarily make moderate to severe frown lines, crow's feet, and forehead lines look better in adults.
Effects of Botox Cosmetic may spread hours to weeks after injection, causing serious symptoms. Alert your doctor right away as difficulty swallowing, speaking, breathing, eye problems, or muscle weakness may be a sign of a life-threatening condition. Patients with these conditions before injection are at highest risk. Don't receive Botox Cosmetic if you have a skin infection. Side effects may include allergic reactions, injection site pain, headache, eyebrow and eyelid drooping, and eyelid swelling. Allergic reactions can include rash, welts, asthma symptoms, and dizziness. Tell your doctor about medical history, muscle or nerve conditions including ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome and medications, including botulinum toxins, as these may increase the risk of serious side effects. For full safety information, visit BotoxCosmetic.com or call 877-351-0300.
See for yourself at BotoxCosmetic.com.
Atheists, agnostics, long-haired weirdos, short-haired weirdos, vandals, hooligans.
The government, hug the government, love the government, hug the government, love the government, hug the government.
Welcome to The Politics Guys, a place for bipartisan, rational, and civil debate on American politics and policy. I'm Northern Kentucky University political scientist Michael Baranowski. I'm joined today by my conservative counterpart, Oklahoma Christian University political scientist Trey Orndorff.
Thanks for having me back.
Absolutely, Trey. And as I mentioned on the weekend show, there was plenty of stuff that we didn't get a chance to talk about. Every week, I think really the change from the far sleepier, quieter Biden administration to this has just been every week for a while there in the Biden administration. Well, it's like, will we have enough to talk about for a regular show and a midweek show? Well, maybe we can find something that's and now it's just like, oh my God, do we talk about this, that? And just even this afternoon, we're recording this on Friday afternoon. And just yesterday afternoon, you sent me a thing about some other story. And I was like, no, we can't do that. Damn it. There's just too much. I can't handle it, man. I'm just shutting down. But anyway, we have a lot.
Well, no, it's true. That's the reason that Ken and I originally started doing the Constitution show. We thought, well, let's do something a little more evergreen because there wasn't always seemingly like a crisis that needed, more show.
But now, my God, it's pick your crisis, basically. But anyway, so here's something that might actually not be a crisis thing, might actually be a not so bad thing. And that's really weird for me. And that's why partly why I wanted to talk about it. So recently, my wife had a prescription filled. And now before her ACA insurance plan kicked in, what the drug she was getting, like a jar of this sort of it's a generic. So a generic topical steroid cream, it was going to cost her over $800, which is okay. That's insane, right? But my point is it ended up not costing that, but there are a lot of Americans who have prescription drug price, just horror stories, and they can't necessarily count on an insurance plan that makes those drugs affordable enough for them. And this is kind of a bipartisan thing, certainly. People on both sides have recognized this as an issue. And recently, President Trump signed an executive order that does a lot of stuff trying to address this. The order is called Lowering Drug Prices by Once Again Putting Americans First. He does have good titles for these things, I got to say. It calls for, changes to the Medicare drug price negotiating program. That was implemented in the Biden administration. And there were some shots about how badly Biden did by putting that in place, but we'll make it better. Don't worry. Anyway, standardizing Medicare payments for drugs, regardless of where the patient's being treated, big discounts for insulin and injectable epinephrine to low-income patients, streamlining the process through which prescription drugs are approved for over-the-counter purchase, making it easier to import certain prescription drugs from Canada, more disclosure concerning the practices of pharmacy benefit managers, as well as investigating potential anti-competitive practices by drug manufacturers. So there's a lot there. And I dislike an awful lot of what Donald Trump has done, but I think this is an exception. It's not going to result in enormous savings, but most of these things in this executive order seem to me to be reasonable attempts to give people at least a little bit of relief from high drug prices. as well as, and I think this is more important, to try to address some of the structural factors that keep prescription drug prices so high in the first place in many instances. So that's kind of my take on this. I do have one big problem, not so much with it, but with an element of it. But before we get to my big problem, what's your take on this, Trey?
Well, Mike, I mean, I would like to be as peachy as you just set that up. I won't lie. Maybe, generally I feel like I'm the peachier one and you're the one who's like, listen, this is bad. Or sometimes that's me and Ken. We're doing court stuff. But here, I guess I'm going to be the Debbie Downer and say, I mean, sure, there are things here that if this felt like the overarching piece of a broader package, I would say woohoo, right? But the problem is that we know that there are other things going on around this that are going to mitigate its effects at the outset. And I'll run through some of this is stuff that affects me all the time. And so it's pretty straightforward. One is we have already seen that the White House has said that it wants to increase tariffs on pharmaceutical material, which at this juncture also seems to include Canada, which would therefore be an antithesis to trying to lower the importation as it outlines here in this particular executive order.
No,
right?
Incoherent Trump policies. I refuse to believe this, Trey. That's just not.
Exactly. So, but it makes me hard to get a little excited about it because I'm like, okay, well, which one's going to win? So, I mean, we both agree that there's going to be an incoherent or a contradictory position, but it then makes me say, well, in the same way that we said at the end of the last show, right? We recognize that Trump uses his statements, changes his statements, I mean, on a head-spinningly quick level. And so the same thing holds true of his writings and his executive orders. And so that is one of my, large practice issues here. But at the same time, if we take a look at what Republicans in Congress are doing, okay, yay, we're going to try to potentially lower some prescription drug costs, while at the same time, we're effectively going to be gutting the subsidies that make many people's, mine included, healthcare plans with the ACA a possibility. So, I guess the thought there being effectively is if my healthcare plan is absolutely not affordable at the outset, potentially, maybe if we don't decide to continue to have a tariff war eating at the edges of my Remicade costs, isn't quite as exciting as it could be if it was part of a larger package of things. And so, when I was reading through this, it was very difficult to not get a little bit of that, like, but if only this was the policy, in other words, if this was the blueprint and I felt like other things were going along with it, I'd probably have more of your, hey, woohoo. But it was very hard for me to read it without that. Like, so for example, you pointed out here in that idea of, costs for both drugs and procedures based on where you are. This is an absolutely huge issue. So for example, early in my care process, now going 5 years ago, when it was not apparent that I was chronically ill, but I was assumed that I was acutely ill, and I had early surgeries. And so I got sent to a wound care center that was ultimately failed because, of course, you can't heal a chronic exit wound. And so that first month I get back these bills, and of course, and they were just, it took me in January, in the first week of January, I maxed my ACA plans out of pocket, because although I had been going to what was clearly, seemingly, a doctor's office in a doctor's building that was not in a hospital, they considered each of those visits a hospital visit. And I was charged accordingly, not only for the doctor and the bed, but also for drugs, which therefore cost more because I was, quote unquote, at the hospital. So again, those ideas here are, I think, worthy ones if I thought that they would, in fact, be pushed forward in a more comprehensive package.
This episode is brought to you by Shopify. Forget the frustration of picking commerce platforms when you switch your business to Shopify, the global commerce platform that supercharges your selling wherever you sell. With Shopify, you'll harness the same intuitive features, trusted apps, and powerful analytics used by the world's leading brands. Sign up today for your $1 per month trial period at shopify.com/tech, all lowercase. That's shopify.com/tech.
Faraday presenta Ojos con Alergia y Picazón contra el jardinero. Y el ganador es Faraday Extra Fuerte. Para aliviar la picazón de los ojos por alergia, actúa más rápido y supera a Claritin y Flonase aún a las 24 horas. Faraday, adelante.
That makes sense. A lot more is being taken away that is being given. And I'm sure the administration would say, and you're not even being grateful for what you're getting.
Yeah,
exactly. You know, that's JD Vance's thing, right? Everyone should just be thanking Donald Trump all the time, you know, ideally on their knees. But in any case, to me, the drug importation thing is just bizarre. Right? I mean, importing drugs from Canada that are often manufactured by the same companies in the same facilities, and yet it's cheaper to import them from Canada and sell them that way than sell them directly to U.S. customers. That's just bonkers, right? I mean, if that isn't an indictment of our system. And now this is a fairly new thing. We don't really do hardly much drug importation at all yet because it works on a state by state basis. It was only last year, January of 2024, Florida was the first state to get FDA approval to import some prescription drugs from Canada. There are, I believe, a couple other states who've applied, but their applications haven't been approved yet. And right there, if that's how you're doing things, clearly your system is broken. And if Donald Trump loves to go big, right? I mean, so it seems to me a far more Trumpian thing would be to say, I'm declaring a national public health emergency. I'm ordering that Medicare pay no more for prescription drugs than the average cost paid by, say, other OECD country members, excluding the U.S. Now, that would be illegal, I'm pretty sure, for a number of reasons, but it would be very much in line with how Trump does other stuff. And so I'm if he's going to do something, go big, Donald, come on, you know. But again, none of this should be happening through presidential fiat. And nearly 2/3 of Americans take some sort of prescription medication, and amazingly, over a quarter of people take 4 or more prescription drugs, according to the Kaiser Family Foundation study a few years ago. And so this matters to a ton of Americans, and there is bipartisan support for change here. 68% of Republicans feel the government should do more to limit the price of prescription drugs. And that's 82% of Democrats, 67% of independents. This is a winning issue. And if Congress can't figure out a way to legislate on this, well, then Congress is basically useless at this point.
Well, that's because Congress right now is on its greatest tracks hit, and it desperately wants to get rid of the ACA one more time. And it's just a frustrating, and I'll be honest, listen, anyway, so for example, right now, we're talking this larger package here. So this comes out, but of course, yesterday, what is RFK Jr. doing? Is he talking about this? Is he talking about getting at the base of those kinds of issues? Or is he calling, my son a not person? And so, I'm with you.
People might not get that reference, Trey, but go ahead.
Okay, well, let's be straightforward. So RFK Jr. yesterday had said that autistic people can't play baseball. They're never going to pay taxes. They're not going to have girlfriends. I'm going to get really upset.
Yeah.
And just to be absolutely clear, my oldest son is autistic. And I would have punched RFK. I mean, honestly, yesterday, I cannot tell you how upset that made me. And not only just for him, I want to be clear, my son plays sports and he is autistic. Go screw yourself, RFK. And my good colleague, his son has Down syndrome. And I want you to know that he also plays baseball and holds the position. But that's the kind of stuff that they're all spending their time on, not this. And so again, if I feel a little bit hot, it is because it's not that I think that the executive order is terrible. It's just that there's this evil stuff going on around it. And so I don't believe it. I don't.
and that's why I wanted to talk with you specifically about when I knew we were doing the show this week. I wanted to talk about this story because you've really had some pretty significant struggles with the healthcare system and dealing with all of these changes and working with the ACA and understanding this in a way that a lot of other people, thankfully, right? I mean, God, we wouldn't wish what you had to go through. I might wish it on Putin, but I wouldn't wish it on most folks, right? And so that's why I wanted to get your take on this. So it sounds like basically it's the administration saying like, well, it's pouring down rain and we did close the window, but yeah, we've blown a few holes in the roof. But, hey, that window is closed. So
it'll be fine. Yeah.
Yeah. Exactly.
Well, and that's the thing to keep in mind, right? Like, so think about the context of my particular situation. I'm willing to share this. It's fine. So I work for a university. I have not broken employment my entire adult life, but I am on an ACA plan. Why? Because we allowed certain kinds of companies, if they had, at certain levels, to effectively not have healthcare plans and therefore could be on the ACA. So one of the things that I think is oftentimes not recognized is, when you say ACA, I think what most people think is some loafer. And again, we can talk about that misconception, but let's just be really clear. A bunch of us are full-time I am a full professor at a private university. I was the chair and the acting dean at that university. So, I'm not some guy who is just playing video games all day. I'm looking at some particular Republicans who made those comments. I am writing things. As a matter of fact, I have worked overtime at that university. And this is not I'm not indicting the university. I'm just saying the system is set up as a result of legislation so that our only source of healthcare is the ACA. So that is the primary, if you want to make changes, that would be the place to do it. And again, right now, what we're on track to do means that tons of American workers who are in fact working, like myself, woohoo, my drugs might be 2.5% cheaper. I'm not against that, especially as a guy who takes biologic agents has to take a biologic agent as an infusion every 4 weeks. That is absolutely expensive. But even that is nothing. That's a drop in the bucket to the fact if I can't actually pay the monthly cost vis-a-vis what I make, as an income. And so again, when I look at the executive order, it is just off-putting to me as a working person who is on the ACA as a result of that congressional structure to then be the thing as opposed to, as you rightfully point out, say, hey, maybe Congress ought to consider the fact that if we're going to make people be on ACA, that we need to make it work. And if you want to get rid of it, then you better start requiring, if you want to say, hey, if you're going to work to get it to have insurance, you better make it possible that everybody who works can have the insurance.
We hope you enjoyed this preview of our supporters exclusive midweek show. If you'd like to hear the rest of the episode, we hope you'll consider becoming a supporter. Supporters get ad-free access to all of our shows, membership in our Politics Guys Discord group where you can join in on the conversation, and other benefits at different levels of support. To become a supporter, go to patreon.com/politicsguys. You can also support us through Venmo, we're @politicsguys, or through PayPal. You'll find all of our support links in the show notes as well as at politicsguys.com/support. And if you'd like to get the midweek show, but you're not in a position to become a financial supporter, that's not a problem. Just send me an email at mike@politicsguys.com, and I'll be happy to get that set up for you.
This podcast is part of the Democracy Group,